Hello everyone, welcome to Nuts Bestie Explains. Today we will see topic from Research, Unit 1, Research and Research Process. Coming to the research means to search again or to examine carefully. Searching again, to search again, to examine carefully. Research seeks answer to questions in an orderly and systematic way. Okay, please remember orderly and in a systematic way. Systematic way means by following few steps in a systematic way, orderly way. Research seeks answer to the questions. If you have any questions, you can conduct research by following some steps in an order, that is by following systematic way to get answers to the questions. So that is research. It seeks answers to questions in an orderly and systematic way. Research is a method of problem solving. So when question is nothing but a problem, when you have problem, you can solve it by following systematic way, few steps. You will find solution to the problems. So that is the meaning of the word research. Coming to the definition of research. Research is a process of systematically searching for new facts and relationship. Notter, according to Notter, it is a process of systematically searching for new facts and relationship. Research is systematic inquiry that uses disciplined method. Okay, it uses a disciplined method and a systematic inquiry into the question to answer questions or solve problems, according to Pollitt and T. Beck. Research is systematic inquiry that uses disciplined method to answer questions or solve problems. Pollitt and Beck. Another definition is scientific process. Research is a scientific process that validates and refines existing knowledge. So whatever answers we get, that will validate and also refines the existing knowledge. It will add more information to the already knowledge whatever is existing and generates new knowledge that directly and indirectly influences clinical nursing practices. Whatever answers we get out of conducting research, we use that knowledge directly or indirectly in our clinical nurse practice. So it is a scientific process that validates and refines existing knowledge and generates new knowledge that directly and indirectly influences clinical nurse practice. These are the definitions of research. Next, if you see nursing research. So coming to our topic, nursing research. Nursing research is same systematic inquiry designed to develop knowledge about issues of importance to the nursing profession. It is a systematic inquiry designed to develop the knowledge about issues of importance to the nursing profession, including nursing profession includes various aspects like nursing practice, that is clinically practicing nursing, education in nursing education, that is in the colleges and universities of nursing, and administration, okay, administration level and informatics. In these four areas of nursing profession, this research is helpful to develop the knowledge about issues of importance, that is nursing research according to Pollitt and Beck. Nursing research is a scientific method. Okay, it follows few steps with which you can prove anytime. Whoever do the research, they can prove, they will get the same answer. That's why it is called a scientific method. Nursing research is a scientific, systematic and orderly process to find out solutions for problems concerning to nursing or generating and refining the nursing knowledge to improve quality of nursing care. So whatever research we are conducting in nursing field, it will help to generate and refine the nursing knowledge to improve the quality of our future nursing care and also nursing education and nursing administration. This definition is according to S.K. Sharma. So these are the definitions of nursing research. Next, need for research in nursing. Need for research in nursing. Research enables nurses to, how research helps the nurses to describe the characteristics of a particular nursing situation about which little is known. This research helps to describe the characteristics of a particular nursing situation. About that topic, very little is known, very less information is there. You can conduct deep, in-depth research to understand the characteristics of that particular nursing situation. Example, nurses work stress. You can conduct research among the nurses who are working in different fields of nursing profession. Research enables nurses to explain phenomena that must be considered in planning nursing care. Example, nurses working concept, teamwork, if they are working in a team, how the work has to be divided and distributed. Nursing care or concepts of psychiatric, pediatric, OBGYNs and water birth, new concepts about which much knowledge is not there. We can work on these topics. Predict. Research enables nurses to predict the probable outcome of. Prediction means knowing the future, predicting the future outcome. Okay, probable outcome of certain nursing decisions. If we take decision like this, what happens? Most probably like this it will happen. So with that assumption, we start the research. At the end, after completion, sometimes we will get the same outcome what we have predicted in the beginning. So the probable outcome of certain nursing decisions made in relation to client care. Example, oral care with lemon, salt, chlorhexidine. In different items they will use and they will check how far the patient is able to maintain oral care, which one is effective. Next, research enables nurses to control the occurrence of undesired client outcomes. Example, muscle dystrophy prevented or controlled by active passive exercise. The patient who is bedridden in the hospital, you can prevent muscle dystrophy by active and passive exercises performed daily. So like this, control the occurrence of undesired client outcomes. Complications you can prevent by giving some therapy like active passive exercise. Like this also you can test some therapies on the patients, clients. Next, initiate with a fair degree. Initiate with a fair degree of confidence activities that will achieve desired client behavior. Example, good or better IPR. Interpersonal relationship makes good or better client behavior. Fair degree of confidence. Okay, good communication, interpersonal relationship with the patient will make good or better client behavior. Okay, like this. Okay, this is the need for research in nursing. And another, why do nurses need research? So why nurses has to involve in research? For the continuous growth of nursing profession. Okay, whatever is invented, we cannot stop with that. We have to grow even in our nursing profession. So for the continuous growth of nursing profession, we need research in nursing. Research helps nursing to achieve its own professional identity. We call nursing as a profession. Okay, we have studied in fundamentals of nursing why nursing is a profession. Okay, so help nursing to achieve its own professional identity. Okay, to continue that professional identity, we need to grow our nursing knowledge through research. Research helps to identify the boundaries of nursing, to define the parameters of nursing for cost containment practices. With less cost, best nursing practice, how we can provide? We can do this by doing research in various aspects. And also need for nursing research to develop, refine and extend scientific knowledge. Whatever scientific knowledge is there, develop that, refine and extend that knowledge. We need research in nursing. Enhance professional knowledge, to improve the professional knowledge in nursing. foundation for evidence-based practices. Mainly research is required for evidence-based practice. If you are following a new technique, further there should be some evidence-based practice. Evidence should be there. To create this evidence, we need to conduct research. After research, whatever results we get, we can follow that in our daily clinical practice. That is evidence-based practice. Refine and eliminate old knowledge. So by refining the new knowledge, new techniques like that, we can eliminate the old techniques and which are wasting our time, lot of energy, lot of equipment if we are using in old techniques. You can eliminate that, bring new knowledge into practice by conducting research. Research enhances professional identity. To enhance professional identity of our nursing profession, we need to conduct research. Identify nursing care practices that are cost effective. To identify new techniques, okay, which are cost effective. With less cost, more output or more comfort you can provide to the patient. So to discover those new techniques, we need to conduct nursing research. And also to answer questions related to nursing practices, education and administration, define the parameters of the nursing. So these are all the needs of nursing research. Next, nursing research as a scientific method. Nursing research as a scientific method. Scientific methods are defined as controlled systematic investigations that are rooted in objective reality. Why we call it as a scientific methods? Because it should have objective reality. In real, it has to be proved. Okay, so it is defined as controlled systematic investigations that are rooted in objective reality and that aim to develop general knowledge about natural phenomena. Purposes are: first one is description, to describe a phenomena, to explore and to give explanation about that phenomena, explain the phenomena. Prediction, after the conducting research, what will be the result? You can predict at the beginning. Control, throughout the method, throughout the research process, there should be control. Okay, like number of people on whom we are conducting research, that is called as sample. Okay, all that will be under control. Prescription, identification of the relationship. Okay, like for example, to prevent muscular dystrophy, active passive exercises, that is one prescription. We are prescribing a therapy, that is active passive exercises we are giving to prevent muscular dystrophy. The result, after 1 month or 2 months, patient will not develop the complication of muscular dystrophy. That is the result. So identify the relationship. Muscular dystrophy prevention, active passive exercises, result is positive. Okay, patient does not develop any complication. Like that, identification of the relationship. By following all these steps, you can prove the phenomena. That's why it is called as a scientific method. Research is called as scientific method. Next, steps of a scientific. So as we said, scientific method means which has a systemic process. It follows a systemic method which has a few steps. So what are those steps of scientific methods? First one is selecting the topic. So the scientific method, same steps you can observe in steps of nursing research also. Okay, so first step is selecting the topic. So research starts with selecting the topic or problem or a question you can select to find the answer, or if it is a problem, to find the solution. That is the selecting the topic. This is the first step of scientific method, also the research. Define the objective. After selecting the topic, with what objectives you want to proceed with your research. Define the objectives, then reviewing the literature about the topic which you have selected. Previously, any research studies are already conducted. That is, finding out those studies, who has done that order, what result they got. All that study is called as review of literature. Very important step in the research. Next, fourth step is defining concepts and variables. Okay, So in your selected topic, there will be some concepts and variables, dependent variable and independent variables. Those you have to define them. Each one you have to define them, because they will vary. They will change at the end of the research. Then stating hypothesis. At the end of the study, what is going to happen? That is prediction. That is stating hypothesis, identifying assumptions. So with what assumptions you are starting your research study? Okay, so those assumptions you have to mention very clearly. Determining ethical implication. Any ethical issues are involved in your study. Okay, so this is very important. That is, any ethical violations, or are you conducting research on children? If it is on children, is it going to harm the children, or is it safe? That kind of ethical issues also you have to clearly state. Describing research design. What type of research design you are going to select for your study topic. Okay, that describe that research design. Defining study population, on whom you are going to conduct the study, or your results, whatever results you get, whom you are going to convey those, like whom you are going to apply those results. So those people are called as population. If you are conducting any study on children between the age of 5 to 10 years, if you are selecting any topic, but of children between 5 to 10 years, whatever result you will get, you will generalize to those population, that is children between 5 to 10 years. So defining study population, clearly you have to decide or define the population. Planning the data analysis. After you get the results, all the data you have to analyze by using statistical analysis. Collecting data from the subjects. Subjects are nothing but from the population. You select a sample. You cannot conduct study on children of 5 to 10 years age group, all children in India or in the world. So you select a few people. Okay, that is subjects or sample, you can call them, like 30, 50 or 100 children between 5 to 10 years. So collecting data from that sample, that is 30 or 50. So that is collecting data from subjects. Then analysis and interpreting the data. After collecting the data, all that data you will analyze and interpret. After doing analysis, calculations by using statistics, you will interpret the data. That is, you will describe the data, what happened, what is the result of your study. Then communicating findings. Whatever results you got, you will clearly communicate the findings, writing form or in the graph chart, pie chart. By using various methods of graphic representation in the form of table, you will communicate the findings of the research. Okay, so these are all the steps of scientific method, and also the same steps you will find in the research also. Next topic, characteristics of a researcher. The characteristics of a nursing research are orderly and systematic process. What qualities a nursing research will have? First one is orderly and systematic process. So nursing research is planned in an order and systematic method. Systematically, steps which we have just seen, 13 steps of scientific method. Those steps will be followed in an orderly and systematic way. So first characteristic is orderly and systematic process, and attempt to control external factors. Okay, without involvement of external factors, by controlling the external factors, the research study will be conducted. Findings are based on empirical evidences. Okay, by using number. Okay, number, and by using graphs, it's a clear presentation of the results. Findings will be given. Okay, so it will have empirical evidence, so it can be, we can able to prove it in the form of numbers, not just our assumptions. Findings can be generalized. Whatever results we get, we can generalize. Generalizing means, as I told you, you cannot conduct a study on 5 to 10 years children who are living in the whole country, India or in the whole world. You cannot reach everyone. So you select a few people, like 30 children or 50 or 100, 200 children, depending upon the study. Then you select them, conduct the study. Same results you will generalize to the all children living in India between the age group of 5 to 10 years. So that is called as generalizing. Whatever results you get, you apply those results to the all children between 5 to 10 years living in India or Andhra Pradesh or Telangana, like that. You will generalize the results. That is called as generalization. Okay, findings can be generalized. That is one characteristic. Then based on assumptions or hypothesis. As I told you, in the research process, one step is formulation of hypothesis or writing the assumptions. Before doing the research itself, at the end, what is going to happen, you will assume in the before itself, you write the hypothesis. Okay, so that is based upon hypothesis. With some assumption, you are going to conduct the study. It may come or it may not come as a result, whatever happens, but with some assumptions you are going to conduct the study. This is also one of the characteristics. Conducted to develop or test theories. So research is conducted to develop or test the theories. Whatever theories already given by our experts in nursing profession, you can develop those theories or test those theories, whether they are proven or not, or they are true or not. You can test those theories. These are all the characteristics of research. Okay, orderly and systematic process, attempt to control external factors. Findings are based on empirical evidences. Findings can be generalized based on assumptions or hypotheses, conducted to develop or test the theories. Next, limitations. There are some limits. Okay, you cannot conduct as you want. There are some limitations for research. Moral or ethical problems. As I told you, ethical problems. The study which you are going to conduct is going to harm the patients, or harm any age group, harm the children, or harm any patients, women, or anyone you are harming them, or is it dangerous? All those moral or ethical problems you have to keep in mind. If it is harming, that study cannot be conducted. Human complexity. Any complex issues which affect humans, those also we have to keep in mind. Measurement problems. Okay, so everything, whatever aspects you are including in your research, that has to be measured in the form of numbers. At the end, the results have to be shown in the form of empirical evidence. Okay, if it cannot be measured, then that cannot be included in your research study, because the result you will get wrong or it will be affected. External variable control problems. External factors, internal factors are there. So external variable control problems. Any external factors which are going to affect the study, those problems, those have to be limited. These are the limitations. Moral or ethical problems, human complexity, measurement problems, external variable control problems. These are the limitations of research.